In this video, we are going to discuss how to monitor your dizziness in heart failure.
Dizziness is a common symptom among all adults, and it is more common among patients with heart failure. The dizziness may be due to both your heart muscle weakness and the medications you take to improve your heart function, which can lower blood pressure and cause dizziness as a side effect. Sudden dizziness can also be caused by heart rhythm abnormalities, which are common among patients with heart failure, and by other conditions unrelated to the heart, such as inner ear disorders. An important part of heart failure care is monitoring the severity and frequency of dizziness. Not only does dizziness cause one to feel poor, but it can also lead to falls. If you experience worsening dizziness that you and your clinical team think is related to your medicines, the risks of dizziness have to be balanced with the benefits of your heart failure medications, which can make your heart get stronger and help you live longer. To better understand changes in dizziness over time, the Engage HF app asks 2 questions about the frequency and severity of your dizziness every 2 weeks. We then score your response between 0 and 100, with 100 meaning no dizziness and 0 meaning very severe frequent dizziness. You and your clinical team can review these responses to understand how your dizziness is changing over time. There are also multiple ways to improve your dizziness. First, briefly sit at the side of the bed before standing, and change positions slowly. Second, you can pump your legs up and down prior to standing up. Third, you can also spread your heart failure medications throughout the day rather than taking them all at the same time. If your dizziness doesn't get better with these tips, if it lasts longer than a couple of minutes or it is severe and makes you feel like you may pass out or causes trouble walking, it is important to tell your clinician. Dizziness is an important risk in heart failure, but is something that can be managed when working closely with your clinical team.